afternoon and good evening. Welcome to the 872nd day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Our guest is Dr.Lima M.D. Homeopathy, joined BHMS at Government Homeopathy Medical College, Trivandrum in 1998, studied BHMS and MD in Practice of Medicine from the same college. Practicing homeopathy for the past 18 years. Currently working as medical officer at Government Homeopathy Dispensary, Karichara, Trivandrum. Also in Seethalayam project by the Department of Homeopathy meant for the upliftment of women and children, and also to deal with the family problems, child and sexual abuses. Previously worked in various projects by the Department of Homeopathy Kerala, like Tribal Project, Anemia Project, Project for Adolescents, School Health Program, Jail Camp Project, Lifestyle Disease Projects, Admired Project for School-Going Children, Project for Destitute, etc. Conducted and participated as nearly 600 medical camps. That itself shows her attitudes towards a social commitment. And the topic is gout and its homeopathic management. An important topic. A lot of persons are suffering from the same, and the traditional or conventional treatment are not at all effective, and it is always a back to square one affair with other medicines, but on homeopathy is always the curative and the rational medicine. So on behalf of IFPH, I welcome Dr. Lima. You can have the platform for the next 40 minutes. It's over to you.
Thank you, sir. Good evening, respected doctors and dear friends. Before going to the discussion, let me thank all the members of International Forum for Promoting Homeopathy to give me a chance to have a discussion. And thank you everyone for coming here. So the topic we are going to discuss is about gout and its management. Before going to the gout, there are different types of arthritis. So there are more than 100 types of arthritis, but we are splitting this into some 5 or 6 categories. One is inflammatory arthritis. Inflammatory arthritis is the damage or inflammation to the joint, which is not caused by any infection or injury. And this type of inflammation may cause the pain, swelling, or stiffness in the joint. And examples that comes under inflammatory arthritis is rheumatoid arthritis, reactive arthritis, ankylosing spondylitis, and psoriatic arthritis. Then the second variety is degenerative or mechanical arthritis. This is mainly due to the damage in the cartilage. So the cartilage will get lost, and the body adjusts itself by forming new bones in that area, which is devoid of cartilage, and that is known as osteophyte. And the arthritis that is coming under this group is osteoarthritis. Another is connective tissue disorder. Connective tissue disorders. Connective tissues are the bands that binds together the body tissues and organs. These include tendons, ligaments, and cartilages. So the patient will be having joint pain, but also he may be having symptoms or other diseases in skin, muscles, lungs, and kidneys. So the arthritis that is coming under connective tissue disorder is SLE, scleroderma, dermatomyositis, and Sjogren's syndrome. Another variety is infectious arthritis, that is due to some bacteria, virus, or fungus. That is Mycobacterium tuberculosis may cause this infectious arthritis. This infectious arthritis is otherwise known as septic arthritis. So Mycobacterium tuberculum can cause infectious arthritis. Salmonella and Shigella, that is causing food poisoning, may cause this septic arthritis. Chlamydia and gonorrhea, that is that is seen in sexually transmitted diseases, that can cause septic arthritis.
Please unmute. Please unmute, Dr. Lima. Please unmute.
Yes, sir. Sorry, sir.
No problem.
Another type of arthritis is childhood arthritis. It is otherwise known as
Please start screen sharing once again. Green button, screen sharing, some technical problems. No problem.
Okay, sir. 1 minute, sir.
Yes, yes.
Is it visible, sir?
Yes, okay. No problem.
Another type of, is it visible, sir?
Yes, yes. If you have, if you need more time, you can divide this program into 2 or 3 sessions. Yes,
Sir, it will
no
finish
problem.
within 1 hour.
Yes, yes, according to your
Okay, sir.
convenience.
Okay, sir. Okay. Okay. The other variety of arthritis is childhood arthritis. It is otherwise known as juvenile idiopathic arthritis or juvenile rheumatoid arthritis. So here there will be permanent damage to the joints. It is due to immune system problems. So now we come to the gout. Gout, we know it is due to the metabolic defect in the body. It is a metabolic arthritis. It can affect any age, but more commonly it is affecting after the age of 30 years. So it usually attacks a joint, or it can affect one or more joints. Usually the affected joint is big toe. So there will be sudden pain and tenderness, especially at night. It occurs earlier in men than in women. Men are affected 3 to 4 times more than women. In women, it is usually seen after menopause or after hysterectomy. The reason is that during the menstrual cycle or menstrual period, there will be a lot of estrogen in the female body. The estrogen helps to control the production of uric acid, and also it helps to eliminate the uric acid that is accumulated in the body. So after menopause, the estrogen level decreases, and it results in the decreased elimination of uric acid and also the increased production of uric acid in the body. And other people that is likely to have gout is obese person, congestive cardiac failure, persons with kidney diseases due to fasting or starvation, vitamin C excess, diabetes, and a family history of gout. This is a picture of gout in big toe. It is also known as podagra. The gout that is affecting in big toe is known as podagra. The causes of gout, we know gout occurs due to uric crystals that is accumulating in the joints. So when there is the uric acid is produced as a result of purine metabolism. Purine in a low level is found in the body. And besides that, the outcome of urine metabolism is uric acid. And purine can be also seen in meat products or in beverages or in sweetened, the juices that are sweetened with fruit sugar, and also in some kinds of fishes. So normally uric acid that is produced after the purine metabolism is dissolved in blood, and it can be eliminated by kidney. But in hyperuricemia or in gout, there will be increased production of uric acid, and there will be decreased elimination from the body. And the uric acid forms urate crystals, and it deposits in the joint spaces, and that causes gout. This is a simple demonstration of gout. These are uric acid crystals or urate crystals that will get deposited between the joints and also around the joints, and it causes the sudden pain and swelling. Not all hyperuricemia cases can be called as gout, and also the gout which is having minimum level of uric acid The person which is having minimum level of uric acid can also develop gout. But hyperuricemia is a broad term that is used to call when there is an increased amount of uric acid in the body. So we said this high uric acid maybe is the result of purine defects in the purine metabolism. Altered purine metabolism leads to the increased production of uric acid. It can be triggered by meat and also some organ meat like liver, then some fishes like anchovies, tuna, sardines, and also some sweetened sugar syrup will causes increased level of purine production and also increases the level of uric acid. And then another cause is decreased excretion of uric acid. Fasting and weight loss can temporarily elevate uric acid level. What is happening is that during fasting or in rapid weight loss, there will be a decreased level of ATP. The ATP or energy level is required for the normal purine metabolism. So an altered ATP and altered purine metabolism leads to an increased production of uric acid. So that is happening in fasting or rapid weight loss. Then certain medicines, diuretics can lead to an increased accumulation of uric acid in the blood. Tumor lysis syndrome that is seen after chemotherapy or cancer treatment that causes increased purine metabolism and also increased uric acid. Then during the alcohol consumption, ethanol is converted into acetaldehyde. Then acetaldehyde is converted into acetate, and this acts on the ATP level. So ATP level and Krebs cycle. So that is functioning of purine metabolism, and it causes an increased production of uric acid. That is happening during alcohol consumption. So alcohol consumption, ethanol is converted into acetaldehyde. Acetaldehyde is converted into acetate, and that causes an altered functioning of purine metabolism, and that leads to increased uric acid. So that is why we are advising patients with high gout or high increased uric acid level to avoid the alcohol. Then another is Lesch-Nyhan syndrome. It is a syndrome with 3 or 4 symptoms, that is spasticity, involuntary movement will be there, cognitive retardation, and gout. Then also another cause of hyperuricemia is overweight. When there is overweight, the body produces more uric acid and the elimination or excretion will be difficult for kidneys. Then certain medicines like beta blockers and aspirin, and also certain medicines that is used to treat cancer, and also chemotherapy, that all leads to the increased production of uric acid and also decrease the elimination of uric acid from the body. Then another factor is family history of gout. If any of the member is having gout, the chances of having gout is very high. Signs and symptoms of gout. Gout usually attacks gout is commonly seen in the fingers and toes of leg and hands. That is because in the temperature, while calculating the total body temperature, the temperature in our extremities, that is in the fingers and toes, are less or cold compared to the temperature in the rest of the part of the body. So the urates which is accumulating have a greater tendency to crystallize in the cooler area. That is why the gout is more seen in the fingers and toes of the legs and arms. Then another term we have to consider is pseudo-gout. This pseudo-gout is due to calcium pyrophosphate deposit. The symptoms and signs are almost similar. Both will be having swelling and redness and tenderness in the big toe or in more on the fingers or toes. But the difference is, we know in gout it is due to urate deposition. In pseudo-gout it is due to calcium pyrophosphate deposition. The another thing is in gout, it is mainly diet is an important factor. That is the diet, it will be triggered. Gout will be triggered if purine-rich food is taken. But in pseudo gout, diet is not considered, or diet has got no importance in pseudo gout. And another difference is in gout, males are more commonly affected than females. But in pseudo gout, there is no such sex differentiation. Males and females can be affected. So that is the if the symptoms are similar to gout, we have to always remember the pseudo gout also, because we have to do the synovial fluid aspiration, and we have to look whether it is due to uric crystal or due to calcium pyrophosphate. So in gout, the uric crystal can be built up in your joints by taking years. It will be deposited slowly in the in our at first in the cartilaginous space, then later it comes between the joint spaces. So these crystals are very sharp and tiny and hard, and when it pricks the synovium or the soft lining of the joint, there will be sudden pain, swelling, and inflammation. The symptoms we all know that is the sudden onset is the most important symptom. Then there will be intense joint pain. It usually affects big toe, but it can occur in any joints like ankles, knee, elbow, wrist, and fingers. Pain is most likely severe within the first 4 to 12 hours of the onset. There will be lingering, the discomfort will be there, last for a few days to few weeks. Later, attacks are likely to last longer. Then inflammation and redness will be there. Even the sheet cannot be tolerated in the gout patient. Limited range of motion is also there. So this is an outline. Gout is due to high uric acid level in the blood. Then 4 to 6% of population suffer from gout. There will be increased temperature, inflammation, redness, severe pain. Kidney do not excrete uric acid, sedentary life or obesity, sugar, fructose, high carb diet, and alcohol are the reasons. This is an example for gout. There is inflammation and redness in the small joint. And another thing that is saying is the victim goes to bed and sleeps in good health. About 2 o'clock in the morning, he is awakened by severe pain in great toe, more rarely in heel, ankle, or in step. And the pain is like lack of a dislocation. There will be chills and shiver, and little fever will be there. Then within 4 to 12 hours, there will be severe pain. There will be severe chill and shiver. After a time, it comes to a full height, and there will be violent stretching and tearing of ligaments, and annoying pain will be felt. And even the bed sheet cannot be tolerated. So we usually comes when we are dealing with gout. We always say that the gout is more common at night after a sleep. The reason is during sleep the body temperature reduces, and also the body will be having a that is sleep starvation, or this is known as nocturnal dehydration will be there. So due to this, there will be a decreased ATP level, and also that leads to the altered urine metabolism, and that causes increased production of uric acid. So there will be flaring of the symptoms due to these conditions, due to the low body temperature and nocturnal dehydration. There will be a flaring up of things. So that is the reason for the gout that is coming at night. And also sleep apnea in obese persons can also cause gout or flare up of symptoms. That is because when there is sleep apnea, there will be hypoxia, there will be decreased level of ATP, and that can alter the urine metabolism, and that leads to the increased production of uric acid. So that is why at night the gout symptoms are increased. Then the stages of progression. Usually there are 4 stages of gout. Stage 1 is high uric acid level. Stage 2 is acute gout. Stage 3 is intercritical gout. And stage 4 is chronic gout or Tophet formation. Stage 1, it is asymptomatic gout hyperuricemia. So when the person accidentally checks the blood, accidentally having blood examination, he finds out there will be elevated level of uric acid in the blood level. So that is this stage 1, asymptomatic gout hyperuricemia. There will be no symptoms, but the person is having high tendency to form gout. Stage 2, this is the acute gout. This is the thing we are usually seeing. We are usually dealt in our hospitals. There will be pain, sudden onset of pain in joint, in big toes or ankles, feet, knees, and rest of fingers. There will be redness, swelling, and there will be some warmth in the affected area. This is known as gout flares, and it can be triggered by, especially the patient will feel, or there will be an intensified symptom attack after the certain foods like meat or alcohol or certain medications or physical trauma or illness. And it will subside after 2 or 3 weeks. But if it is left untreated, that can lead to chronic gout. Third stage is interval or intercritical gout. Here there will be no symptom. So between 2 attacks of gout, this interval or intercritical gout happens. During this time, there will be no attack of symptoms, and a patient will usually feel a pain-free period after an attack. It can last for months or even years. But the blood level will show a high level of uric acid. Stage 4 is tophace, the chronic tophaceous gout. This is the most debilitating form of gout, and it takes a long time. It takes about 8 to 10 years to form this tophace or deposition of urate crystal under the skin. It is usually seen under the skin, in and around the joints, and it causes permanent damage to the joints and other internal organs such as kidney. So proper treatment can prevent the development of tophace. And this tophace is built up of needle-shaped crystals that causes hard lumps to form under the skin, in and around the joints and other organs. Usually it is painless at the beginning, so the patient, so the symptoms get unnoticed. But later the pain, it will become so painful, and it will cause a debilitating condition. So the most common area of tophace are over the top of the toes, back of heels, front of knees, back of the fingers and wrists, around the elbow and the ears. This picture shows the tophace in the helix of the ear. So this tophace, when this is a small swelling, we get unnoticed. So this is also a tophace of helix of ear, and so at first, in the beginning, there will be no pain. Later, there will be pain. So this is a demonstration of tophace. This urate may collect under the skin, and small pimple-like tophace are there. These are some of the pictures. This tophace takes about 10 years to develop like this, and all these are tophace. So what can trigger an attack of gout? An injury can trigger, an illness that gives you a fever can trigger, having an operation or surgery or trauma can trigger the attack of gout. Receiving a vaccination can trigger a gout. So this is what is happening nowadays. Many patients will complain after taking COVID vaccination. There is when the blood is examined, accidentally they find this uric acid level increasing. And also there will be more pain in the joint. So the reason is the vaccination can normally, any type of vaccination can trigger gout flare in some patients. Not everyone can have a trigger, or not everyone will have a high level of uric acid level in the blood, but some patients will have trigger of gout flare after vaccination. Then fatty meal, drinking too much alcohol, dehydration, obesity, all or sudden increase in weight, all can trigger an attack. So the diet and regimen push to prevent gout. Usually gout is, though it is a metabolic disorder, there is an inflammation also. So the anti-inflammatory foods can prevent or control the gout to some extent. That include ginger, garlic, lemon, cherries, turmeric, pineapple, and hot peppers. And food that can trigger the gout attack includes seafood like tuna, anchovies, sardines, mussels, and meat like beef, organ meat, pork, lamb, beverages, all alcoholic beverages, and also sugary drinks. Vegetables like spinach, cauliflower, asparagus, and mushroom. That is because in spinach, there are controversies regarding the intake of vegetables. Some experts say the spinach, cauliflower, and asparagus and mushroom, though they are having high purine level, they will not flare up the gout. But mostly, most of the experts say to avoid or reduce the intake of spinach, cauliflower, asparagus, and mushrooms, and also oatmeal, peas, and dried beef. So these will trigger the gout attack. So what we have to do is to have a healthy diet. Avoid foods that may trigger a gout flare, including the food meat that we already dealt. Alcohol should be avoided. Then we have to have a lot of water. We have to take around 2 liters of water should be taken. Then moderate or mild physical activity should be done. Especially in obese person, we have to reduce the weight. Otherwise, there will be decreased level, there will be increased production of uric acid. So we have to have a physically active life, lose weight, we should reduce our weight, and we should protect our joints from injuries that can worsen the gout. So we have to do mild exercises like walking, bicycling, or swimming. Don't engage in strenuous exercises that can cause much stress on the joints. So if we are having gout or increased level of uric acid, there is a high tendency to have renal calculate. So we have to drink at least 2 liters of water to decrease the chance of stone forming. Then avoid the sweet and soft drinks. Then we can have fresh fruit juice, but fruit juice mixed with sugar should be avoided. Then researchers suggest that skimmed milk and eating low-fat yogurt may help to prevent the attack of gout. Then gout attack can usually occurs at night. So there will be always having a trouble of sleeping. So we can prevent or we can have a good sleep when these conditions are noted. That is, rise the affected joint on a cushion. Put that is not possible in all cases. Put ice on the joint. That is not possible. But we can raise the affected joint. Then we should not cover the affected area. That is, we should not cover or we should not put any bed sheets on the that touch the affected area. But we can keep the cushions or bed sheet on the sides of the affected area. Then we should have to have a peaceful sleep. We can have a dark or dim light. Take a warm bath before the bedtime helps to ease the pain and stiffness. Then we can have a regular routine, and that is a regular time for going bed and waking up. And gentle exercise will help to have a good sleep. And we can prevent gout if we change our lifestyle. That is regarding the diet and regimen. If it changes, we can prevent or we can control the gout. Then keep the area. If it is coming on the daytime, we can have an ice pack or a bag or that is a pack that is kept in refrigerator, can be wrapped in towel and can be placed in the area. That will give some amelioration to the pain and swelling. Then rest of the affected area can be given, and support the surrounding areas of the affected area with bed sheets and cushions. Then the diagnosis of gout. We know usually we come across or we find gout during blood test, but blood test is not a confirmatory for to diagnose as gout. We have to have synovial fluid test, or sometimes scan may be also useful. Blood uric acid test. Gout can occur when uric acid levels are as low as 6 milligram per 100 milliliter, but an individual can have serum values as high as 9.6, may not have gout also. So uric acid level can be varied based on sex. In females, normally it is about 1.5 to 6 milligram per deciliter, and male it is between 2.5 to 7 milligram per deciliter. But it can also vary with labs. Various labs will be having various normal range of uric acid level. It is always desirable to have a uric acid level below 6 milligram. So blood test is not a confirmatory test. We can diagnose this gout by doing fluid effusion. We can find the uric acid crystals or urate crystals in the synovial fluid. That is the diagnostic test for gout. Then X-ray interpretation. So there will be deposition of urate crystals. So 50% of patient will be having bony changes in the 6 to 7 years of initial attacks. So there will be asymmetrical polyarticular distribution. The feet and hands are commonly involved. Then another is tophae. Tophae are soft tissue masses. So here we can see in this X-ray there is an increased soft tissue mass is here. That is the tophae. They are usually seen in periarticular area and also can be seen in interarticular area. Then another thing is punched out erosions. Erosions can also, here we can see a punched out erosion here. It is a typical sign of gout. So the borders can be sclerotic because of the process, creating a punched out or mouse bitten appearance. Then within the bone also there may be a punched out lesion, that is interosseous lesion. Uric crystals are deposited between the bones and it can be calcified or it cannot be, or tophae just it may be seen without calcification. This can be also seen in gout. Then sclerotic overhanging edges. Here we can see there is a hanging area. There is a punched out lesion is there, but outside it there is a hanging area. It is sclerosed. It is also a feature of gout. And irrespective of other arthritis, the joint spaces are preserved in gout. There will be no marked reduction in joint space in gout. Then there will be no bone loss there will be no marked bone loss or osteopenia. The bone mass or bone density is preserved in gout. Even though the edges are eroded or sclerosed, the total bone mass is preserved in gout. This is a tophae. This is a tophae. There is an enlarged area is there. So these are all tophae. Radiograph of tophae. Here there is a punched out ulcer. Sclerosed area is there. And another diagnostic is joint aspiration. This is a confirmatory test for gout. The urate crystals can be examined under the microscope from the synovial fluid. Another test is dual energy CT scan, but it is very costly. So it is not practicable to all the patients. But here in dual energy CT scan, it is confirmatory for gout. Here the gouty areas are marked as red, green in this dual energy CT scan. The other areas are marked in other colors, but gouty areas are marked as green color. It can be used for prognosis also. That is to know whether the green area is decreasing or not. So the dual energy CT scan is also a prognostic test. But due to the expense, it is not practicable to all patients. Another thing is ultrasound. So we can see this tophae or swelling or all these in ultrasound. Then medicines for gout. There are a lot of medicines in homeopathy that includes bryonia, ledum, calmia, colchicum, rustos, cactus, whatever the medicines may be. The mechanism is that it affects the it acts on our purine metabolism, altered purine metabolism. It makes the purine metabolism corrected, and it causes the normal level of uric acid production. And another mechanism of our medicine is it acts on the kidney. It helps to eliminate the uric acid from the kidney, and the uric acid levels are maintained in our body. And another thing is our medicines are like phytolacca and calcarea and all that acts on the fatty person or obese person. And when the obesity is decreased, there will be normal purine metabolism, and that can lead to the normal production of uric acid, and also it will help to eliminate the uric acid by the kidneys. So whether there are many, whatever the medicine we are giving, the mechanism is this: the medicines are acting on our body. It acts on the purine metabolism. It regulates the uric acid production, and it also helps to eliminate the uric acid from the body. So this is a case that came to our hospital. The patient is a female with 49 years old. She was having uric acid around 8.5. So here, when the history is taken, she has done hysterectomy. So that is the reason for this uric acid at the age of 49 years. So due to hysterectomy, the estrogen levels are decreased, and it leads to the increased production of uric acid and also decreased elimination. And after our treatment, it is reduced to 5. It becomes normal. Thank you.
Yes. So one treatment due to another disease. That is what happened the last case. It was recorded with homeopathy medicines. That's an important thing. So time for discussion. Those who would like to participate, please go to the participant list and raise your hand. A lot of topics were discussed. A lot of matters were discussed. And it's very important to have a comprehensive knowledge of this disease because, as we said, this prevalence is around 5%. So you can estimate that how much persons are affected or how much are there in our society is affected with this complaint. Because of nature, it is the toe often the patient cannot walk or he cannot do this normal life. Definitely that will lead to some other complications. So obesity is another complication. Then definitely it has got some economic aspects also. Then the different types of arthritis are discussed, and she mentioned about 100 types of arthritis are there. The inflammatory type, the degenerative type arthritis, connective tissue disorders, then infective arthritis. So many types of arthritis are there. Well, all these are acting through the organism by affecting the vital force, the life force. So as far as the life force is intact, this will not create much impact on the body. That is most important. That is why we are concentrating upon that aspect. Then the prevalence, as I mentioned, Dr. Lima, what about how will you differentiate between the gout as well as the pseudo gout? I think she's. Yes.
Sir, in gout, it is due to the urate deposition, but in pseudo gout, it is due to calcium pyrophosphate deposition. And also in gout, males are more commonly affected. Males are 3 to 4 times more commonly affected than females. Yes. But in pseudo gout, the sex differentiation is not marked. Both sexes are equally affected. And also in the gout is triggered by certain food, alcohol, and also injury and all that. But in pseudo gout, there is no triggering factor, or there is no importance to the diet. So the only diagnostic, we can differentiate these two by doing synovial fluid effusion or aspiration.
Yes.
Synovial fluid aspiration. We can differentiate. In gout, there will be urate crystal, and in pseudo gout, there will be calcium pyrophosphate.
Okay. Then regarding the different stages, Dr. Lima explained stage 1, stage 2, then 3, 4 types of gout are mentioned. What is more interesting to see is the X-ray changes. That is a very wonderful exposition. The bony changes, the swelling, the punch out erosions, the indrosis lesions, well, this sclerotic overhanging area. So all the way it's a very nice presentation. And yes, Hariharan sir is there. Sir, what is your opinion? Yes, and doubts. Yes, sir, please, you can unmute now, sir.
Hello. Hello. It is a nice class. Nice class. All the pathology she explained very well. Very good. But doctor, what are the laboratory investigations usually done for this for this gout laboratory investigations? What are the laboratory investigations?
Usually, sir, the serum uric acid level is tested, and also the ASO titer and RA factor is also tested along with it to rule out other types of arthritis. But the uric acid during the blood test, there will be increased amount of uric acid. Normally, in females, it is between 1.5 to 6 milligram per deciliter, and male it is between 2.5 to 7 milligram per deciliter. But it is usually helpful if the uric acid level is kept below 6 milligram per deciliter. So the uric acid, the laboratory investigation that we are doing primarily is blood test, and that includes serum uric acid level, RA factor, ASO titer, and our routine blood checkup to rule out whether to rule out to if it is due to an infective arthritis or like that. Then another thing is the synovial fluid aspiration, and from that we can find this urate crystal, and another is X-ray, and another is a scan. Usually this synovial fluid aspiration and blood result will confirm the gout.
What about the CRP level, doctor?
CRP level can be raised if it is an acute infection. The CRP level can be raised, but usually in chronic gout this will be normal only.
Okay.
Yes.
Very good. Very good. Very good.
Yes. If anybody would like to participate, or you can add something, or you can have some doubts, clear it.
Doctor, what are the homeopathic medicine usually you prescribed for this gout and arthritis? What are the main medicines? See,
okay.
I usually give this urticurans in order to reduce the uric acid level. I found it is very effective, but it will not cure, but constitutional approach will do very good result. We can relieve the pain and by constitutional approach, and the patient will get comfortable.
Okay, sir. Thank you. Thank you for that advice.
Then what about the complication of this gout, Dr. Lima?
The complication is, the complication may happen when the stage is when the gout approaches the stage 4. There will be it will cause a debilitating. It will become a debilitating disease. There will be reduction in movement. Then there is a high chance to have kidney diseases. There is a high chance to have hypertension. Then this patient will be having the patient who is having diabetic will be a high chance to have this renal failure. So this main complication is the debilitating situation, and also the renal calculus.
There is the importance of the constitutional medicine and the anti-miasmic medicine. Apart from beyond the therapeutics, it's most important because we can expect this is definitely these are the chronic diseases, and of course, as a result of this chronic disease, the presence of miasm, the patient, it is quite natural to have the sequelae after the acute disease. So, Dr. Hubert De Silva, yes, please.
Hello, can you hear me? Can you hear me? Doctor, it was a very nice presentation and a very scientific presentation. Doctor, I want to ask whether this uric acid, this gout and ganglion formation, is there any relevance?
No, sir. Ganglion is due to an injury in the nerves, but uric acid is due to the changes or urate deposition in the joints. So these two are two different conditions. So ganglion usually occurs after an injury or changes in the nerves. Usually it is seen in the wrist area. So these two are two different conditions.
Okay, okay. How can we differentiate it?
So in ganglion, there will be no sudden onset of pain or inflammation or tenderness. Tenderness is rare in ganglion. In some cases only, there will be tenderness in ganglion. But in gout, there will be the onset will be the pain will be intensified. There will be changes in the affected area. Usually, it is seen in the near the joints. That is in the big toe, or it can be seen in wrist also, but ganglions are usually found in wrist only, and it is filled with a jelly like fluid. When we examine it, there will be a jelly like fluid will be there, and it can be appear along the tendons or joints of wrist and hand. It is usually seen more on the wrist, but it can occur in any area. It can occur in ankle or feet, but usually the presentation of ganglion is seen in the wrist area. There will be no redness, there will be no inflammatory signs, or there will be no limitation in movements of joints.
Thank you very much.
That
Thank
is
you. Thank you very much, doctor.
Yes, during the physical examination, it can verify it will move up and down in case of ganglion. That's the most important as well as the clinical medicine is concerned. Dr. Lima. Yes.
Sir, during the clinical examination, there will be we can feel a jelly-like substance or a jelly-like thing in the ganglion. But in gout, there will be no such
Moreover,
thing.
This will move along the tendon when you press it.
Yes, sir. Yes,
that's the
sir.
most important thing. Differentiate between a bony involvement. Yes. Now, Dr. Rajan, sir, please.
Thank you for your excellent presentation. I attended the last part of your class, so I have not heard early part. But diet and regimen is important factor to manage this lifestyle. Change of lifestyle also very important. Prolonged use of Coca-Cola is one of the major cause of the gout. So lifestyle changing is one important factor. I think ammonia force and calcare renal is also considered for the therapeutics. Calcare, ammonia force and calcare renalis. Thalapsy BP also give Tylophora also give very excellent result. What about your diet and regimen opinion?
Yes, sir. Diet and regimen plays an important role in gout. This is the diet that causes altered purine metabolism will flare up the gout complaints, and also it may lead to chronic gout. So the diet, there should be the patient should be having around 2 liters of water per day. Then the patient should reduce the intake of meat and also organ meat like liver. Patient should reduce the intake of seafoods like sardines, anchovies, and tuna and mussels. And also, patients should not take any flavored or sugary juices. That is like Sir said, the Coca-Cola and other soft drinks should be avoided. Alcohol should be completely stopped. And also, another thing is the patient the gout is usually seen in common in patients that is doing gym exercises. So strenuous exercise leads to the altered urine metabolism, and it can increase the production of uric acid. So the patients the patients with young age that is coming to our hospital will be having this gout, that is due to their over exercise or strenuous exercise in gym. So moderate exercises should be advised in this gout. And also sleep is an important factor. There should be a sleep for around 6 to 7 years per day.
Okay, thank you.
Okay, now Dr. Veena. Yes. Dr. Veena, please unmute and yeah.
Good evening, doctors. So this is regarding my experience with Ruta. 90% of the cases they clear with Ruta for ganglion. So the difference between ganglion and gout, I think when you palpate, this ganglion is superficial. It doesn't have anything with the have to do something with the bone. it is on the tendon. So the mobility along the tendon and on palpation, it is not deep, it is superficial. All these things are the clinical features. And in gout, definitely the diet restrictions are important, the red meat and other things that increases hyperuricemia. And one of the main complication would be going to renal calculus also. So we should take holistic approach there. Not only the joints, we have to check the renal calculus also along with gout, and we have to restrict even beans and other beans, leguminaceous plants or food. We have to restrict with the patients in case of vegetarians, and non-vegetarians. Definitely they have to avoid red meat. So especially people who are in Gulf and Middle East, they tend to have more hyperuricemia because of the food culture over there. And slowly this biryani culture is increasing in India, especially in South India. So this has got a lot of influence on this hyperuricemia levels in the blood levels, and these are very evident nowadays. So diet is very, very important. Thank you, doctor.
Okay. Yes. Now, Dr. Hariharan, sir, please. Please unmute, sir. Hariharan, sir, please unmute.
See, doctor, in order to control the gout, all the doctors are said the same, but see, my opinion that make the blood pH always in alkaline. That is the best way, alkaline. See, take raw vegetable juice. Raw vegetable, very good for this to maintain the pH level in alkali. One of the main, usually I am doing that. I am giving this kumbalanga neer, see, morning. That is very good for to maintain the alkalinity. See, regarding this ganglion, my suggestion is that according to Singal, years back, I cured a lot of cases with the sulfur CM, and if it is failed, give Silesia 10 1 dose. It will be cured, no doubt in that.
Okay.
Okay,
Yes,
it is my experience. Thank you very much.
Yes, okay. Thank you for sharing experience. Now, Dr. Pranav, please. You can unmute now, Dr. Pranav. Yes.
Namaste to everyone. So
Yes.
this is Dr. Pranav. Previously, the doubts which I had was cleared in this session. So thank you to Dr. Lima M.L. And now new doubts have got evolved. The one is that what is the cure percentage in homeopathic treatment with in terms to gout? The second one is it is slightly deviated, but we are having a few rubrics in Kent repertory, like abdomen gouty metastasis, chest gouty heart, and one more would be stomach gout metastasis. So has anyone used this rubrics, or is there any when to use these rubrics? So if you can let me know, it will be great. Thank you. Is my question clear, or you want me to repeat once again, sir?
Lima?
Yeah, it's clear, doctor. It's clear. We can control we can regulate the uric acid level at the early stages. That is, when the degenerative or when the before the permanent damage stages, we can, of course, we can control the uric acid, and also we can prevent the tophae formation. We can make the person to lead a normal life with our medicine. But when the patient comes after the tophae formation, we can only we cannot alter or change the shape of the tophae that is formed. We can reduce the symptoms, like there will be no pain, there will be reduced level of uric acid level, more tophae will not be formed in the body, and all that thing can be done with our medicine. but our medicine can have 100% guarantee in the first, second, and third stage. So
Okay, ma'am.
there will be complete cure, or there will be no symptoms at all.
Okay, ma'am.
Yes.
And about the rubric part, can you elaborate, ma'am? Like we are having in Kent repertory, we are having rubrics like abdomen gouty metastasis, and one more we have chest gouty heart, and in the similar way we are having stomach gout metastasis. So, do you have any? Can you please provide later on that?
Okay, doctor. Usually the gouty tophae are usually found underneath the near the joints, but in some cases there will be localization of gouty tophus in the liver or abdomen or like that. So in our repertory denotes these terms to that type of symptoms or symptoms. So the thoracic gout tophus or abdominal wall protrusion. There will be a gouty or tophae-like appearance in our abdomen, and it is known as abdominal tophae or abdominal gout or like that. I think the rubrics point out that type of based on the symptom it is written. That is, it looks like a tophae. There will be increased uric acid level, and the term is denoted like that. Manoj sir will tell more about that thing.
Definitely a lot of reflections needed. I think the material medical report is always, especially the cancer report is always based upon the symptoms. So that the consequence of the diseases, that may be the meaning of the rubric. Anyway, when describing about the diet and regimen, it is usually a custom of the medical science to blow hot and cold to some diets without any logics. But what is usually happening is that as homeopathists, as genuine homeopathists, we must think on the as well as on the miasmatic background as well as on the prescribed medicine. Definitely, if you give the raw food and vegetables to these patients who is on the psychotic background, naturally there will be definite aggravation. So you should mind on that.
So actually,
Yes, yeah.
may I add, doctor? Actually, this gouty deposits, this tophae, can get deposit in the muscles and likewise in the heart valves also. So I think
Yes.
those rubrics indicates the complications or the rare presentations of the gouty deposits in heart and abdomen or other muscles, even liver, pancreas also been reported.
Yes.
So these are the rubrics to be taken care of the severe gout where these tophae deposits are there in heart valves or liver or pancreas.
Okay. Medicine said Lithianka, Robertanum will definitely help, and it's time to wind up the session. May I invite Dr. Masrina to express the word of thanks. Dr. Masrina, are you there? Please unmute.
Yes. Thank you so much, Dr. Lima. It's a very interesting session. I'm sure we have benefited a lot. There's so much experience that you have shared with us, and on behalf of IFPH, I wish you all the best and more sharing. Would like to hear from more sharing from you in the future. Thank you very much.
Yes, that was Dr. Masrina from Malaysia. She's a regular participant, and we are very happy that those who are attending the program are really benefited, and it will grow the scope of homeopathy as well as the scope of common man who are suffering from diseases and suffering from ignorance. Even though homeopathy is very much available, they are still, because of the pride and prejudice. That is the most important thing. And we all know that common sense is very uncommon. There is another obstacles to development of homeopathy. Anyway, it's a very wonderful presentation, and you should also regularly participate in our programs so that your brain will be enriched, because a lot of medicines and informations are pouring beyond the capacity of our brain. We must to enhance the GB of our brain, I think. So, well, with that comments, let me conclude today's English session. Hope you to meet the same day tomorrow. Till then, goodbye. And it is all Dr. Elizabeth for the continuation of program in Malayalam. Thank you.